Effective cough relief. A practical guide to cough is a natural bodily response to irritation in the airways. Whether caused by a cold, allergies, or acid reflux, coughing helps clear the throat. While most coughs resolve on their own within weeks, several strategies can provide temporary relief. Understanding your coughs are triggered when nerves detect irritants and signal the brain to expel air from the lungs. Common causes include infections like colds and flu, allergies, and even certain medications, like ACE inhibitors. The important thing is that most coughs are self-limiting, but managing symptoms can significantly improve daily life. Daytime relief strategies for coughs disrupting focus or daily activities. Consider these options. Expectorants. Over-the-counter options like Mucinex contain guaifenesin, which thins mucus for easier expulsion. This won't stop the cough, but it makes it more productive. Caution. Avoid in children under 4 and follow dosage instructions carefully for older kids. Cough suppressants. Dextromethorphan-based medications temporarily block the cough reflex. They don't address the underlying cause, but can offer short-term relief from dry, hacking coughs. Again, use with caution in young children. Warm beverages. Tea or lemon water soothes irritated throats and loosens mucus. Cold drinks may also help reduce inflammation. Hydration. Drinking plenty of fluids thins mucus and prevents buildup. Fruits and vegetables contribute to hydration. Dehydration thickens mucus, making it harder to clear. Hard candies. Sucking on sugar-free hard candies stimulates saliva production, moisturizing a dry throat. Avoid sugary candies due to their inflammatory effects. Warning: never give hard candies to young children. Nighttime cough management. A nighttime cough can disrupt sleep. Consider these tips. Elevate your head. Use extra pillows to prevent mucus from pooling in the throat. Humidifier. A humidifier can add moisture to the air, reducing irritation. Warm liquids before bed. Soothe the throat and loosen mucus before sleeping. When to see a doctor, persistent coughing, especially with other symptoms, warrants medical attention. Consult a doctor if you experience wheezing, fever, shortness of breath, greenish yellow, phlegm, chest pain, unexplained weight loss. These symptoms could indicate asthma, COPD, allergies, lung conditions, or even heart problems. Ignoring these signs can delay necessary treatment. The bottom line: most coughs resolve naturally. Simple remedies can provide temporary relief, but persistent or severe symptoms require professional medical evaluation. Staying informed about medication use, especially in children, and recognizing warning signs are crucial for effective cough management.